This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, April 14th, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Methadone Dose and Patient-Directed Discharge in Hospitalized Patients with Opioid Use Disorder. This retrospective observational cohort study of 554 individuals examined rates of patient-directed discharge, or PDD, among hospitalized patients with opioid use disorder who received methadone during the first 72 hours of hospitalization from July 2019 to June 2022. Higher doses of methadone were associated with a decreased risk of PDD. For each additional 10 milligrams of methadone received in the first 24 hours, there was a decrease in odds of PDD at 48 hours. This study highlights the importance of adequate treatment of opioid withdrawal to reduce the risk of PDD. Next is an article in JAMA Psychiatry and is titled Mirtazapine for Methamphetamine Use Disorder, a randomized clinical trial. In this Phase 3 randomized trial, use of the antidepressant mirtazapine in routine clinical practice reduced methamphetamine or meth use in adults with methamphetamine use disorder, or MUD. Participants used meth for a median of 24 days over the past 28 days. The mean reduction in days of meth use from baseline to week 12 was greater in the mirtazapine group than in the placebo group. There were no unexpected safety concerns for mirtazapine. Our next article is in Translational Psychiatry and is titled ECM Remodeling in the MPFC Exacerbates Cocaine-Induced Hyperactivity and Impairs Threat Vigilance. The extracellular matrix, or ECM, plays a crucial role in addiction-related neuroplasticity. While chondroitinase ABC or CHABC-mediated ECM degradation has been shown to impair drug-conditioned place preference, its effects on cocaine-induced locomotor activity remain unknown. Using 3D motion capture combined with unsupervised behavioral clustering in a chronic cocaine exposure mouse model, this study demonstrates that cocaine treatment significantly increases locomotor activity while impairing environmental threat perception. The results highlight the complex, context-dependent role of ECM in addiction-related behaviors and suggest the need for more targeted approaches to ECM-based interventions for substance use disorders. Our next article is in Addictive Behaviors and is titled Early Onset of Cannabis Use and Risk for Opioid Use Disorder Across 2 Decades in the United States. This study used data from the National Survey on Drug Use and Health from 2002 to 2024 and the National Epidemiological Survey on Alcohol and Related Conditions from 2001 to 2002 and 2012 to 2013 to evaluate the association between early cannabis use and development of opioid use disorder. Approximately 1/5 of respondents who used cannabis reported use prior to age 15. After adjusting for socioeconomic factors and other substance use, individuals who used cannabis before age 15 had increased odds of past-year OUD and lifetime. Early cannabis use was also associated with increased odds of injection heroin use and fentanyl use. Next is an article in Annals of Neuroscience titled Internet Addiction and its Association with Depression, Anxiety, and Quality of Life Among School-Going Adolescents, a cross-sectional study. Researchers conducted a cross-sectional study in India among 12 to 17-year-old students to assess prevalence of internet addiction and association with depression, anxiety, and quality of life, or QOL. Overall, researchers found 41%, 16%, and 1% of students were classified as having mild, moderate, and severe internet addiction, respectively. In addition, 27% had significant depression and 3.2% had severe anxiety. The researchers found a correlation between high Internet Addiction Test, or IAT, scores and higher Beck's Depression and Anxiety Inventory scores. Higher IAT scores were also correlated with lower QOL. The authors note that the association between internet addiction and psychiatric comorbidities could be bidirectional and recommend screening students with problematic internet use for depression and anxiety. Our next article is in Addiction and is titled Comparative Effectiveness, Safety, and Acceptability of Pharmacological and Psychosocial Interventions for the Treatment of Cannabis Use Disorder, a network meta-analysis. Researchers conducted a network meta-analysis including 21 psychosocial and 36 pharmaceutical studies to evaluate effectiveness of multiple possible treatments for cannabis use disorder. Overall, while there was some evidence for various psychological and pharmaceutical interventions to reduce cannabis use and improve abstinence, there was low to very low certainty for efficacy. Psychological interventions that may have some benefit included dialectical behavioral and commitment therapies, cognitive behavioral therapy with contingency management, and contingency management alone. Psychological interventions that may have some benefit included dialectical behavioral and commitment therapies, cognitive behavioral therapy with contingency management, and contingency management alone. Pharmaceutical interventions that may be of benefit included cannabidiol, N-acetylcysteine, and varenicline. The authors note that given low certainty, these findings should be viewed cautiously and more research will be needed. Our final article is in Proceedings of the National Academy of Sciences and is titled Predicting Individual Incubation of Opioid Craving by Whole Brain Functional Connectivity. Relapse driven by craving is a central challenge in treating opioid addiction. Using resting state fMRI and connectome-based predictive modeling, this study identified a whole brain connectivity pattern that predicted incubation of oxycodone craving after voluntary abstinence in rats. Connectivity changes during abstinence predicted the magnitude of incubation, measured by increased oxycodone seeking from early to late abstinence. The predictive connectome involved interactions among cortical, basal ganglia, insular, hippocampal, and sensory motor systems. Pharmacological inactivation of the dorsomedial striatum modulated connectivity strength within this network, demonstrating a causal role of the connectome in the incubation of craving. These findings identify a brain-wide marker of incubation of opioid craving and provide a translational framework for developing targeted interventions and monitoring therapeutic outcomes in opioid addiction treatment. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.